And the reason we're interested in talking about this today is to start to highlight how you can use emotion maps and kind of expansions of the emotion map method in clinical practice. The emotion map itself I designed about 10, 12 years ago now, back in the early 2000s, to research family relationships, and it was done through 2 ESRC projects, one behind closed doors and the other enduring love couple relationships in 21st century. And what those projects both did was to look at how parents and children, or the adult couple, relate to one another on an everyday sense and experience their relationship in the spatial environment of the home and the emotions that are involved in that process. So that's where the social research dimension came in.
As a researcher on the Enduring Love project, I became really interested in the use of emotion maps. And to begin with, the term emotion map seemed a little bit strange to me, because I wondered, how can we actually use this in systemic psychotherapy? And that's partly because the whole field of emotions and the whole area of emotions has had such a vexed history for us as family therapists. And we think of emotions really as interactional rather than innate and socially constructed, and really existing in the intersubjective space between family members, which is why I think for a long time family therapists were quite wary of using emotions or even thinking or talking about emotions. And that's changed recently. And I thought that the emotion map would fit in very well with other visual methods like genograms, cultural genograms, as well as sort of more action techniques and methods like sculpting. And there's a brilliant paper, in fact, in Family Process about using sculpting with couples. And I thought that emotion maps would fit in quite well with such techniques that have a long tradition in academic sociological research and in family therapy research. But it was really sort of bringing these two together that I thought would be really interesting.
So in social research terms, we produced emotion maps by generating a floor plan of the family home with a couple or a family. And this is either drawn by them or by the researcher. And then once you have the floor plan, stickers are placed on the different spaces around the house, around different objects around the house as interactions take place. So a different colour is for each person. So if we say, yellow is the colour of a mother, then, if there's a nice moment where the mother might hug the child, who would be in this instance, say, purple, then you'd have that on the family bed. And you start to build up this picture. And then what happens is, well, okay, so dad comes along and dad can be red here. And suddenly dad's on the family bed as well. And then suddenly you have a nice heart. And then this big picture emerges of how is this family interacting? Oh, the bedroom's a really happy space for them. So that's how we used it in research in the first instance.
Yes. And then I was thinking of how we can extend this to clinical practice, and started using the emotion map with families in my clinical work. I began actually by using it in the research with a South Asian family, which made me think that the emotion map would be a very useful tool with hard to reach and minority ethnic families. And we would have to think about the way in which the family and the couple relationship was constructed very, very differently. And we've written about this and talked about this in a Journal of Family Therapy paper and corresponding podcast. But then I thought, why don't we sort of extend this a little bit and start using it more spontaneously in clinical practice? And in this paper, I've talked about one of my clinical examples, which I've labelled Transforming Anger. And in this case example, which both of us, I think, are just sort of really excited about, we show how the emotion map can be used far more spontaneously. So the little girl, whom I've called Catherine, I've disguised and changed her name to protect confidentiality, and got permission from the family to use their emotion map and drawing. She was a sort of natural drawer, if you like, and she drew this absolutely lovely picture of her family, which made me think that she might actually really enjoy using the emotion map and be able to use it effectively within family therapy sessions. So I took some emoticons into the session, into my next session, and left them sort of lying there with the other art materials. And she spontaneously picked them up. And as we were talking about a conflict between her parents and the impact it had on her and her brother, she drew out an emotion map.
Which is just lovely, and we include that here in the paper.
It was very colourful.
Yeah, it was colourful, but it was so immediate. Sort of the tensions in that family were palpable.
Yes, yes. And we had talked about these a lot and tried to work with them in different ways. But this just really showed the conflict. And as in the research, the conflict is centred around certain rooms. So, for example, in this emotion map, it's what she describes as the mud room, which is the hall. And conflict often used to erupt in this family when it was time to leave the home. The dad getting very angry, uncontrollably angry, about the delay in the children putting their shoes on, for example. And then this created a lot of tension in the family. And she drew that beautifully. And the next session that I had with the family, I was able to bring the emotion map, and my next session was only with the parents, and talk about the effect that the dad's anger was having on the children in their different ways. And this seemed to have had a real impact in their being able to take in and think about the effect of what they were doing really to their children, which is not to say that they may not have been able to do this with just talking about it. But again, as you say, it was the immediacy of it and seeing it from their daughter's eyes really in a very different way.
And I think it's that dual process of, one, the child felt able to vocalise her experience without using words. It's literally the immediacy of a grumpy sticker.
Yes.
But also for them, to the parents, to see it in such a visual form.
Yes.
It's you know, it takes your breath away in the sense of it makes you stop short and think again. So it's that sort of dual process, I think, of empowering for the child when quite often they're more silenced, but also then seeing it, you know, take that more positive step. And I guess for me as a researcher, it's great to see a method that was conceived in research then have such a useful applied context, not as the panacea, but just as one instrument amongst many, which may have purpose.
Yes. And the other striking thing is that after a period of time when this family came back and things were much better after Christmas, Catherine then drew a completely different emotion map. And the family, again, were really pleased to see how much things had changed in their relationships. And, you know, you'll see just how sort of striking the difference is. And this is a family now that you see a lot of smiley faces. You do see some sad faces, but they're sort of much rarer. And she was able to talk about what that was about. And lots of hearts as well. So it might seem sort of simplistic described in these terms, but it actually felt quite profound, and the changes in the family felt profound as well. And again, this is not to say that this was brought about only by the emotion map, because a lot of it centred in the therapeutic relationship, other things that had changed in their family outside the consulting room.
And the duration of time.
And the duration of time, and lots of other positive things. But yes, I think sort of really being able to focus on going with the flow of visual methods and using them then to show the parents the effect that their anger was having and their relationship was having on the children was a very important part of this work.
So, I mean, I'm absolutely happy to always send the stickers out if people contact me at the Open University, and the sheets of stickers that are easy for me to post. But also you can do it in a more rough and ready way just by drawing the smiley or the sad face or the heart, and that is what we talk about in the paper with another therapist as well who has used it in that context.
Yes, and I think that sometimes clinicians might be quite confused about actually how to use this method, and what we're doing at this point is devising some clinical guidelines which hopefully will be available quite soon as well on the website.
Yes. And that's the Enduring Love website, which is enduringlove.co.uk, and then as and when the app becomes available, then that will also be freely and widely available. So that will extend the use of the method, because it will be a multi-platform app, which would be great in that clinical context to take stuff to home. It's a useful prop, and children do love stickers. So, I mean, that's why it's had such a good use, I think, in that family context.
Yes.
Thank you.